has revealed a fresh round of tariffs on the pharmaceutical industry. Now, under this plan, Britain would face 100% tariffs on drugs imported into America. UK companies are now raising their prices in response. Let's get our heads around this by talking to healthcare economist for the Consumer Choice Centre, Fred Roeder. Fred, very good evening to you. The issue of tariffs make my brain ache because it takes a little bit of compound thinking to work out who benefits and who doesn't. Now, we already have a problem, Fred, in the UK with drugs since Brexit actually is one explanation, which is that our pharmacies are being charged a certain amount for the drugs that they're buying from the EU, which are high. They claim back the money from the government and there is a gap that the pharmacists are going to be closing because they already can't bridge that gap. What will this mean? Will it just exacerbate that problem?
It would mainly hurt US patients because it's a direct tax on the health of US patients. So if this 100% tariff on pharmaceuticals coming from the UK to the US would actually apply, then US patients and the health system would just pay twice as much for drugs from the UK. Most likely there will be lots of exemptions because they already say if you're going to have some manufacturing in the US as a pharmaceutical company, most of them have because it's like the world's largest pharmaceutical market, these tariffs again might not apply. What the tariffs definitely do is bring more uncertainty into the health system. On the one side, the Trump administration says we want to cut drug prices, cap them with the so-called most favored nation executive order. And on the other hand, they want to localize all pharmaceutical manufacturing through this 100% tariff. So it's kind of says two things at the same time, and it definitely brings in confusion. UK patients should be much more worried about the planned price controls of drugs in the US, because right now the US more or less funds most pharmaceutical research in the world, and US patients do. And European patients tend to spend much less in health systems on the same drugs. So if the Trump administration starts capping drug prices in the US, Europeans probably will have to pay a bit more. It's the same debate we have around NATO. For decades, Europeans have been more or less free riding on very high US defense spending within NATO, which is something that's also right now changing, right? European countries have to increase their defense spending, and most likely European health systems will have to increase their spending on drug prices if Americans decide they want to spend less on it.
I've got my panel still here with me, Rebecca and Sarah. Do you understand? Stay with me. Don't go anywhere at the moment, Fred. Just stay with me while I bring the panel into this. Do you understand this, Sarah, in terms of how it might affect British people?
I mean, I think what President Trump is trying to do here is what he promised to do, which is take on Big Pharma. He wants protection for patients. He wants to not be bowing down to the pharmaceutical boardrooms. And clearly, that doesn't just apply to here in the US, it applies to the UK too. He has been the first US president in recent times to actually be willing to take on Big Pharma in this way. And so far, some of those moves he's made have been beneficial to American patients. So it's very interesting to see how this could play out for the UK.
Yeah, Fred, is your understanding that if this starts to affect American people, American patients, or those that need the drugs, would Donald Trump row back on it? What would his next chess move be?
Drug price controls can be a very quick, short win for policymakers because you can show that you brought drug prices down. The problem is for those patients who suffer from diseases we cannot cure yet, they will be mostly impacted because investments into new cures go down. And that's usually something that's only coming on the market and benefiting the patients 2 election periods later. Right, so it's a bit of a cynical political game to jeopardize innovation in biopharmaceuticals 10 years further down the road. But if we as patients should be all concerned about innovation halting and stopping, with drug prices being regulated. And I think it's a bit unfair to always just blame the innovative pharmaceutical industry, because there are lots of layers and layers and layers of middlemen within the US health system, which is even something the Trump administration pointed out. and a lot of drug companies start trying to sell directly to the patient, which is actually something the White House likes to see, because it cuts out lots of layers of margins in the middle, bringing drug prices down, which is a better tool than top-down price controls, which is something a Republican government shouldn't be doing, right? I mean, that sounds more like out of the toolbox of Bernie Sanders.
Thank you, Fred. Fred Roeder there, healthcare economist for the Consumer Choice Centre.